This is Priscilla Johnston, and I'm doing the clinical case reflection presentation on the practicum at Seeking Safety. The clients served at St. Francis Ministries through the Seeking Safety Substance Use Treatment Program are families where the parents and or adolescents who have been diagnosed with PTSD and substance use disorder. The families are referred by the Department for Children and Families to help prevent the removal of children from the home. When making first contact with a family before starting the Seeking Safety program, an initial adult and or adolescent intake packet needs to be completed. It is explained the services are provided at their home and the Seeking Safety program is for 6 months. During the visit, we meet the family where they are at. This could be to establish safety and or meet their basic needs. If it is to establish safety due to, for example, discontinued substance use, letting go of bad relationships, reduce risk of suicide, or other things, we teach families how to ask for help from safe people, how to utilize resources in the community, and take care of themselves. Are a few examples. If they need assistance with their basic needs, such as to maintain housing, continue to have electricity, water, gas services, or other basic needs, we find the resources to help get their bills paid. We assist to stabilize families so they can be safe and or do not have to worry about their basic needs being met and are able to move forward on themselves when starting the Seeking Safety program. Education and about PTSD and substance use disorder is provided and how PTSD and substance use disorder trigger one another. There are 25 treatment topics and safe coping skills covered in the program. Some examples of the treatment topics are safety, PTSD, taking back your power, detaching from emotional pain, also known as grounding, when substances control you, and asking for help are a few examples. Some examples of safe coping skills are soothing talk, setbacks are not failures, pretend you like yourself, cry and reward yourself. Each treatment topic and safety coping skill applies to both PTSD and substance use disorders. Case management is also provided to families to do follow up on how they are doing, progress made on their goals, and help connect them to resources and services in the community. When meeting with families, it can be individual and family counseling. There is also a women's group that meets every week on Thursdays for women who would like to attend. The treatment topics and safe coping skills are covered in the women's group. Currently, due to COVID, virtual meetings are being done with clients through different applications such as WebEx, Zoom, and Skype. Transportation is also provided for clients who need to attend appointments and meetings. The Seeking Safety treatment program located in Salina covers the following counties: Saline, Cloud, Ottawa, and sometimes Sedgwick. On staff, there is a clinical director, supervisor, an addiction counselor, and a peer mentor. When working with families, it can be with both parents, a single parent, and or adolescent. The families work with range in sorry. The families we work with range in diversity: Caucasian, African American, Hispanic, and individuals with Indian heritage. Recently, we have had a client where the Indian Child Welfare Act applied. We assisted the client to relocate to live by the Indian reservation to be able to receive the services, resources, and benefits needed for her and her family. There are staff who do speak Spanish and can assist speaking Spanish clients and interpret for other staff at some of the offices. There are a few forms and the Seeking Safety brochure that are in Spanish. At St. Francis Ministries, they do have diversity, equity, and inclusion workshops and other related workshops to educate staff on the backgrounds and the culture of others. St. Francis Ministries does not have a appropriate line available if assistance is needed for other languages. This would really come in handy to overcome a language barrier when you need to communicate with clients who speak a different language. Most of the clients served through the Seeking Safety Treatment Program are below the poverty level. Their services are covered by a grant funded through the Family First Prevention Services Act. The presenting problems will include a diagnosis that is substance use related. It could be alcohol use disorders, stimulant use disorders, cannabis related disorders, or tobacco use disorders. And a mental diagnosis can be PTSD, anxiety, delusional disorder, depression, bipolar, among others. We collaborate with mental health providers and physicians to confirm diagnoses and to monitor medication if applicable in the treatment process while assisting clients to meet their needs and goals. Some examples of short and long-term goals are develop relapse prevention skills to stay clean and sober, learn how to deal with cravings in a positive way, make changes in my life to support an alcohol and drug-free lifestyle, acquire knowledge about addiction, and be able to relate back to myself and my addiction. I recently had the opportunity to have my first client. When assisting the client in the environment, I felt part of what was contributing to her presenting problems is her relationship with her husband. They were being negative toward one another and causing each other to be upset by bringing up the past on what each of them had done. I recall a client telling her husband he is not her dad and to stop treating her like he is. I believe this is due to their age difference. Client's husband is 30 years older than her. Client stated she would like her own place, but that they are still living together because she currently does not have other options. Being unemployed and no longer receiving unemployment are contributing to her presenting problems as well. And her mental health, client stated she was diagnosed with anxiety and delusional disorder. Back in 2016, she was prescribed medication for the delusional disorder. Next, I will discuss what I believe has helped with alleviating the problems. The following week, the peer mentor was able to get client into an Oxford house. Department for Children and Families was contacted and their office approved for client to receive assistance with the rent for 2 months. Having this community resource will help client to start and focus on her recovery. Another goal is for client to have employment by December 1st, so she then can take over payments for her rent. Client has been applying for jobs daily. She has been employed since 2014 and has plenty of job experience. Client did recently start mental health services. She plans to continue mental health services and will check to see if she needs medication for her delusional disorder. Client has been to drug and alcohol treatment before and has attended meetings. She is also familiar with the 12 steps. Client wants to receive services through the Seeking Safety program and start attending AA meetings. The peer mentor will provide case management to client and is available for anything client needs. Additional for other additional services and resources. Other strengths the client has is her relationship with her mother and her being a good mom to her son. When client starts AA meetings, she will meet other individuals and be able to have a sponsor, which will expand her social network and have additional support. Client will be able to focus on her and the needs of her child. She is stabilized and is able to move forward in treatment with the Seeking Safety program. Seeking Safety uses cognitive behavioral therapy and applies psychodynamic theory in changing thought patterns and teaching coping skills to deal with cravings and triggers. The treatment topics relate to each content: cognitive, behavioral, interpersonal, and case management. CBT is present and problem-oriented to reduce current symptoms. It is brief, time-limited, and structured with the goal of strong treatment gains over a short time frame. It is educational and emphasis on rehearsal of new skills. It is directive and collaborative, guiding patients much as a good parent would while emphasizing patients' mature contribution to their own treatment. These processes provide, in the very format of the treatment, an antidote for the powerlessness and lack of control inherent in PTSD and substance abuse. Psychodynamic theory is applied by using the working through technique. The client is asked or states how they are feeling. The counselor will ask why they are feeling that way, and after the client responds as to why, the client will then discuss this with the client. This technique promotes critical thinking, which can help the client to look at what is causing their feelings and why they feel that way. The interpersonal content is added through some of the treatment topics. The interpersonal topics help teach clients how to have supportive relationships while letting go of the destructive ones. The case management content, as mentioned earlier, is to follow up on how clients are doing, the progress made on their goals, help connect them to services and resources in the community. This approach is per the Seeking Safety curriculum. The following assessment tools I was able to use with my client were the Safety Protocol, Needs List, Substance Abuse Subtotal Inventory, also known as SASE, Kansas Client Placement Criteria, also known as KCPC, Being a Parent, Mother, Father, Drug Use Questionnaire, the Alcohol Use Disorder Identification Test, and Strengths and Difficulties Questionnaire. The safety protocol helps me to determine if the client is at risk for suicide. The needs list helps me to see what is circled on the list that the client feels they need. Some examples are acquire knowledge about addiction, resolve grief issues, and eliminate dealing drugs. The needs list also gives me an opportunity to talk about their strengths, weaknesses, liabilities, for example, court, probation, community service, and activities involved in or resources to help develop their treatment plan. The SASE and KCPC are both drug and alcohol assessments. The addiction counselor showed me how to score the SASE assessment and will be showing me how to use the American Society of Addiction Medicine criteria, also known as ASAM criteria, to determine the diagnosis for a client. The addiction counselor explained that comparing the SASE and KCPC results will be able to show if there is a discrepancy or if the client is not being honest. The KCPC helps to determine the treatment plan for a client. The Being a Parent, Mother, Father, Drug Use Questionnaire, the Alcohol Use Disorder Identification Test, and Strengths and Difficulties Questionnaire assessments are given to see how clients are doing at pre and post treatment to see the correlation on how the treatment worked and is helping. These assessment tools will help me to see how effective the treatment was and how much it helped the client. The specific techniques employed in helping the effort through the Seeking Safety program are check-in and check-out handout, grounding exercises, and teaching safe coping skills. I will have the opportunity next week to apply some of these techniques with my client. At the beginning of the visit, I will apply the check-in and check-out handout. Check-in starts out since your last session with the following questions. 1. How are you feeling? 2. What good coping have you done? 3. Any substance use or other unsafe behavior? 4. Did you complete your commitment? And 5. Community resource update. Checking out has the following. 1. Name one thing you got out of today's session and any problems with the session. 2. What is your new commitment? And 3. What community resource will you call? There are 3 different types of grounding exercises I could have client practice. These are mental grounding, physical grounding, and soothing grounding. The goal of these exercises is to help client detach from their emotional pain and let go of their negative feelings. The client can decide which grounding exercise works best for them. There is a total of 84 safe coping skills a client can practice. The client can decide which safe coping strategies work for them. When discussing treatment topics, they are relevant to both PTSD and substance use disorders. Also, each treatment topic a Also, in each treatment topic, a safe coping skill is addressed. How I will take into consideration ethnic and cultural factors are having an open mind, meeting the client where they are at, explain the process of treatment from start to finish, such as like initial adult packet, drug and alcohol evaluations, how their diagnoses are determined, and how this also helps to determine their treatment plan. How long treatment plan will be. Take the time to listen to client's perspective of their situation. Answer questions and concerns client may have, and collaborate with client on establishing their treatment goals. I will ask the client who they would like to be involved with their treatment planning. I recall asking the client where she was born, what is her primary language at home, who she has relationships with in her family, what is her religion, does she receive support from her family, and what hobbies she has. These questions can help to identify clients' cultural, racial, and ethnic identity. Some of the questions I took to supervision were the following: what to do if a client is at risk for suicide? The supervisor said I am to staff with her immediately and take client to get a mental health screen done at the hospital. I will need to explain to client it is my job to make sure they are safe and to stay with them until they are checked in, or if a family member or friend arrive at the hospital, to be with them. I can ask for the family member or friend to call and let us know what happened, or I can call the hospital. I will ask our client to sign on an authorization form for the release of information for us to be able to communicate with the hospital and the hospital with us. I will also need to document the incident and make sure there is a follow-up appointment with mental health. This is reassuring to know I need to do when this occurs, and knowing I have the staff support for guidance. The next question was, when does a treatment plan need to be updated? The supervisor said, as I get to know the client, I will add goals and objectives. The initial plan needs to be updated at the end of 30 days and again updated to a 90-day treatment plan before the next 30 days are up. I will need to be sure to meet the due dates of when the treatment plan needs to be updated. The next question was how to do the progress notes. The supervisor said for me to use the SOAP format and to be sure to exclude names and only use their job titles. Also to write them in accordance with the treatment plan. I will continue to send my progress notes to staff to receive their feedback on how I am doing. From what I have seen with staff working with clients, using CBT and the mentioned techniques have been very effective in helping them. The staff helps clients build strength, confidence, and self-esteem while working on PTSD and substance use disorder. Clients are assisted to be safe and or get stabilized first by connecting them to resources, whether it is to get their own place and or have funds to get their utility bills paid. The staff have weekly visits and provide support to clients. There is a client who completed and graduated from the Seeking Safety program. One of the things I have seen for some of the clients is the addiction counselors for both individual and group have sent court reports and or attended court to advocate for clients. They let the court know when clients are following all recommendations and give an update on their progress. Okay, so what I have next is, let me see here. Okay. Goodness gracious. In the back page, sorry. Okay. So it's questions. Okay. Questions. Okay. So questions I have about the clients that we work with is I was wondering what resources are available for clients to continue to receive treatment if their children go into foster care. And the other question is, are there facilities which provide housing for the whole family while receiving substance use disorder treatment? And then for the next part, the feedback, what areas would you like for me to elaborate on? And was I able to answer my questions you may have had through my presentation? And I apologize. I know this took a little bit longer. I felt like this is kind of awkward because I had to be over here and have this phone plugged in order to do the recording. So I hope that the presentation was okay. And thank you so very much. Bye.